Hi, welcome everyone. We are going to get started in just a minute. Thank you for your patience. So hello again and welcome to the UNC Water and Health Conference 2021. My name is Sarah Lebu and I'm a PhD student. I'm here at the University of North Carolina, Chapel Hill, and I also work at the Water Institute. I'll be your room host for today, and I'm deeply grateful that you're able to make it for this session. So before we dive into the fun part, I would like to go through a couple of announcements. And first, I would like to highlight that we have our networking and sponsors event that will happen right after this posters session. So once the poster session ends, please head out to the Remo platform to network with other colleagues and sponsors. And instructions for signing into Remo can be found on the conference website. I would also like to remind us that we have a fun night of trivia lined up for tonight. So right after this posters presentation, also head over to Remo for the trivia night. The winning team will receive discounted registration to attend next year's in-person conference. And this is a reminder that the chat function on Zoom has been disabled. We invite participants to type out their questions and their comments on the chat function on Pathable. Thank you. And while we get ready to get into today's presentations, we will have 4 of them, and this is the order of the presentations today. So I will stop sharing my screen and we will dive right into it. So I would like to introduce the first speaker for this presentation. We will have Michelle Farrington go first. Michelle is the Public Health Promotion and Community Engagement Lead at Oxfam. We will go ahead and share her presentation.
Hi everybody, my name's Michelle Farrington. I'm the Public Health Promotion Lead for Oxfam, sitting in their Global Humanitarian team. And I'm here today to present our research on understanding the barriers to inclusion of older people with incontinence in humanitarian WASH programming. The research is led by Oxfam and HelpAge and is being conducted in Ethiopia and in Malawi, where we're working with local research partners. In Ethiopia, we're working with the Federal Ministry of Health, and in Malawi, we're working with MANEPO. The research is funded by ELRA's Humanitarian Innovation Fund and by the Institute of Development Studies. So the reason that we're doing this research is that older people are very rarely asked about their specific WASH needs in humanitarian contexts. And one of those needs is quite often the issue of incontinence, which is a complex issue, but essentially is where a person is unable to control the flow of their urine or feces. There's a lack of awareness and understanding about this issue amongst WASH practitioners, and therefore it's very often not addressed in humanitarian contexts. So the aim of this research really is to try to develop a practical and sensitive methodology to help WASH practitioners understand the scope and the scale of the issue of incontinence and how it affects older people. The research is mostly using qualitative methodologies, and that's because we really want to hear from older people themselves and really want to hear about their experiences and recommendations for how WASH practitioners can deal with this issue. So I should mention that the research is not yet complete. We have undertaken some initial research in Ethiopia and in Malawi, but we do need to do some further research in both contexts. So here I'm just going to share the initial findings that we found from both countries. So in Ethiopia, one major finding that we had was that the issue of incontinence was often very wrapped up with the concept of being bedbound. So there wasn't really this understanding that people with incontinence can be mobile, but that really that people who had incontinence were bedbound. When we spoke to older people, they expressed feelings of shame, loneliness, neglect, and stigma relating to incontinence, and that it impacted on their lives, making them feel isolated, causing them to limit their food and drink, and also had quite significant psychological impacts on them. Suicide was mentioned in 3 of the focus group discussions that we had as being one of the main coping mechanisms that people found they had for incontinence. Many people were using kind of homemade coping mechanisms, things like bedpans, digging latrines closer to their house, or relying really heavily on the caretakers to wash them and wash their clothes and bedding. We found very similar findings in Malawi, but we also found that older people there were saying that incontinence impacted on their ability to earn money and participate in community life. Incontinence as a result of witchcraft or bewitching was mentioned in some of the focus group discussions and some of the household visits. And we found that there were very large discrepancies in terms of the type of support that was being given to different households. In terms of the recommendations that have come so far from older people, a lot were around providing additional hygiene items that could support, so things like additional soap and water containers, plus more specific non-food items such as mattress covers, additional bedding, and clothing that could support with regular changing. Most importantly, in both contexts, psychosocial support was really highlighted as being a major need. In terms of the next steps, we have some more data collection to do, but we are compiling together the analysis and the recommendations for WASH practitioners, and we hope to have the final report and findings available in December 2021. Thank you very much for your time.
Thank you so much, Michelle, for this bringing this meaningful work into highlight. I would like to invite participants to present their questions for Michelle. Please type those out onto the chat. And she's gone ahead and presented her poster. Michelle, do you have any final thoughts, any important points you'd love people to go home with?
Just maybe to reiterate that we're still kind of going through the research at the moment. We do actually hope to travel again to Malawi and to Ethiopia before the end of this year. And one of the things that we would really like to do as part of that trip, those 2 trips, is share the research findings that we have so far with the research participants, so with the older people themselves. And really hear back from them in terms of the recommendations. So this research is really heavily relying on input and feedback from older people themselves to help guide what we should be recommending to WASH practitioners. So we are trying to keep it very participatory and very much focused on the needs of older people.
Thank you very much. Please give us a second while we deal with that.
I don't know whether there are any questions coming through or not.
Yes. So there is there's a question in the chat, and it says, does the issue of incontinence apply to other age groups as well?
Yes, absolutely. It can be a very, very common issue amongst all age groups. So it can range from from children. Quite often we see as a result of trauma. There can be bedwetting or renewed bedwetting. If a child has kind of outgrown bedwetting, they might start bedwetting again because of trauma. And we saw that a lot in the Syrian context. But also it can be a result of lots of different issues as well. It could be that somebody is born incontinent, either urinary or fecal incontinence. It can be due to childbirth or complications during childbirth. It can be due to older age. It can be due to certain types of illnesses. So there really is kind of like a broad range of causes for incontinence. And of course, it can affect anybody at any age. this project is specifically looking at the needs of older people, but we are also linked with 2 other projects, one of which is looking at the issue of incontinence in children, and the other is looking at incontinence specifically in women post-childbirth. So we hope to kind of bring the learning from those 3 research studies together to get a more comprehensive picture of the incontinence needs of different people during emergencies.
Thank you. That's really helpful to know. And there's a follow-up question regarding your results. So Brandy is asking, were there any differences noted between the sexes?
No, we haven't really found too many differences between the sexes. Most of the time we're hearing very similar things coming from older men and older women in terms of, you know, how they cope and what kind of coping mechanisms they're using at the moment, the kinds of impacts that it has on their lives. We're not seeing a huge difference really between the 2 genders at the moment.
Thank you. That's really helpful. We do have time for one more question. So if there's any question with the audience, please type it up and I'll read it out for the speaker. In the meantime, Michelle, so incontinence is an issue that's often not talked about in WASH. What do you predict will happen in the next 5 to 10 years as regards how well this issue is prioritized?
I think what we as the research team would really like to see is this issue kind of grow in WASH practitioners' consciousness the same way that menstrual hygiene management has, let's say. So, you know, in terms of MHM, also quite a taboo subject that people were shy to talk about. But now I think there is a lot more confidence in WASH practitioners to talk to women about MHM and to address the issues that they might face. And I think we're really hoping that this research and the other 2 pieces of research that I mentioned are really going to encourage that openness and that willingness to explore this issue in much greater detail in WASH and hopefully to find some solutions and kind of making it part of kind of core WASH programming rather than something that is an add-on or is something that is an extra to think about. I think we'd really like to see it as being something that is standard within WASH programs.
Thank you so much. Well said. I will transition to our next speaker.
Thanks.
Thank you. I would like to introduce Lizzy MacRae Garvin. Lizzy is the Manager of Program Quality at Life Water International. We will go ahead and share her presentation.
Hi, my name is Lizzy MacRae Garvin. I am the Manager of Program Quality at Life Water International, and I'm honored to present our poster, Mobilizing Local Volunteers to Support the Vulnerable with WASH, on behalf of my 5 co-authors. Our work captures the results and learning from a Life Water strategy to specifically include marginalized community members in WASH programming. Today, we are reflecting on the results from 3 such programs in the Kaliero, Mayuge, and Kakamiro districts in Uganda. Leave no one behind is one of the key principles codified in the Sustainable Development Goals, which in part is a commitment to eradicate poverty in all its forms, end discrimination and exclusion, and reduce the inequalities and vulnerabilities that leave people behind. However, it is often the case that implementing organizations struggle to know whether or not they are in fact reaching the most marginalized and vulnerable people in their pursuit of achieving the SDGs. In 2018, Life Water developed partnerships with local volunteers, which included community members and social and religious leaders in Uganda, to help engage vulnerable households in WASH activities. The volunteers were asked to help their vulnerable neighbors become healthy homes, a Life Water certification that means a household has met 5 key WASH practices: storing treated water safely, using an improved latrine that provides complete privacy, washing one's hands with soap and water, drying dishes off the ground, and maintaining a compound clean of animal feces and rubbish. The purpose of this certification and the corresponding behavior change is to put into place household level practices and infrastructure that interrupt the fecal-oral transmission of pathogens and reduce WASH-related disease. In the 3 districts, LifeWater staff and community leaders identified 220 vulnerable households based on the local context. Community leaders provided rationale as to why the household was considered vulnerable, such as extreme poverty, displacement, or being headed by a vulnerable person, such as a child, widow, or someone with severe illness. In total, 633 community volunteers were trained to tangibly support their neighbors through activities like digging latrine pits, building drying racks, and supporting the purchase of wash items, such as soap and jerry cans. Following the training, these volunteers were paired with the previously identified vulnerable households based on their geographic location. For 21 months, LifeWater staff and volunteers visited every registered vulnerable household at least quarterly and often monthly to monitor and support their progress toward becoming a healthy home. Healthy homes were certified by LifeWater staff who verified each of the 5 criteria and recorded the data through a mobile platform. By the end of March 2021, 202 vulnerable households had been registered as healthy homes. This represents 96% of the total number of vulnerable households. In comparison, 95% of remaining households had met all of the healthy home criteria during that time. So returning to the central SDG principle of leave no one behind, this approach is a promising model for including the most vulnerable households in WASH programming. We have learned that organizations can effectively target and support vulnerable people through a process of first, identifying marginalized households in conjunction with community leaders. Second, mobilizing community volunteers to support these marginalized households. And third, conducting regular monitoring visits to assess progress, offer encouragement and support. We are excited to continue this strategy in 2022 and appreciate your time. Thank you.
Thank you so much, Lizzy, for your presentation. I invite you to share your screen and take up any questions from the audience, and please direct your questions for Lizzy on the chat. And in the meantime, Lizzy, we'd be happy to hear your thoughts about anything else you'd like to add.
Thank you so much. So again, I just wanted to thank my other co-authors, some of who are in this room right now, others in Uganda who aren't here, but their work was really integral to this poster presentation. I think what is interesting about this strategy is the way that it involved pre-existing local social structures and really wasn't creating something new, but was more a way to reframe how neighbors supported one another. And what was interesting is following some of our evaluation work about this strategy and our projects more broadly, we really saw that in the data. We saw in the qualitative data for focus group discussions and in-depth interviews that community members shared that this really impacted their communities. It changed their perceptions of their neighbors and how they could be part in helping their neighbors with WASH, and really seeing WASH as something that extends beyond the household. So we're excited to continue this strategy. This was the first implementation of this strategy in Uganda. Started about 3 years ago with a brief hiatus due to COVID, but we're looking forward to trying it again starting in 2022.
Thank you for that. I really appreciate it. There's a question for you, Lizzy, and it says, were there any specific criteria in selecting the communities, and were there any major obstacles?
Yes, that's a great question. So as far as selecting the communities, these were communities that were identified as part of our 3-year WASH program. So the entire community would have been included in this strategy. And this was just based on a geographic area as well as WASH needs. So in addition to the vulnerable household strategy, our organization implements a number of other WASH interventions, such as constructing water points, latrines, working in schools, working on CLTS and ODF verification. So this is a component of a strategy that we did across many neighboring communities over the 3 years. And I see another question from Michelle. So she asked, how did you approach less visible vulnerabilities in your study? And interested to know, were there any differences between how you and the volunteers and community members identified vulnerability? That's a really great question, Michelle. So as far as the criteria for vulnerability, it was intentionally flexible so that it could be grounded in the local context. So what is vulnerable in one community may not be vulnerable or marginalized in another community. So we really provided a wide range of vulnerable criteria or suggestions for what vulnerability could mean. It could mean a child-led household. It could also mean maybe an immigrant or a refugee, and it could be someone with severe physical disabilities. But as far as was there a difference between how the community members and leaders identify vulnerability? I don't think there was a big difference. I think there was a lot of agreement as far as who needed the most support for WASH in the community. So thinking about families that would not be either physically or financially able to construct a latrine. That would be an example of something that we could come together on and really see, okay, well, how can we surround this person with support to achieve other WASH goals of the project?
We have time for another question. So it says, what will be the advice for replicating this model? And the second part of the question is, what incentives are there for having been registered as healthy homes?
That's a great question. So for replicating the model, kind of about my previous responses, I think this really involves a locally grounded approach. So I think there's a good amount of formative research that should go into implementing this strategy. We did it in 3 districts in Uganda, but in a different context, it may look different. So I think the acceptability of this approach would be something to determine. As far as incentives for being registered as healthy homes, there were no incentives outside of a small celebration and a sticker on the household. So it was really motivated by households' desire to improve upon their household level WASH practices and facilities. And that was through a series of behavior change messaging and community events that really helped households capture the vision for what their community could look like if everyone adopted these 5 practices.
Lizzy, if you can quickly take this one in just a minute. Did you encounter any barriers in the community consultation process?
We did not encounter any significant barriers. I think one consideration that is worth exploring a little more is the perception of vulnerability from those who are identified as vulnerable. So if someone was identified by their neighbors, or they self-selected and said, I need a lot of help with WASH, were there any, what are some challenges that could be mitigated with that? For the most part, we didn't see any challenges, but I do think that there are times where someone who is considered vulnerable or marginalized may receive money from different organizations or goods from different organizations or government, which was not our approach. So I think there was a little bit of negotiation that needed to happen around that, of what it actually means to be considered vulnerable under this strategy, which is essentially that your neighbors are going to help you with WASH. So I think that'd be something to keep in mind for future implementation of this approach.
Thank you so much for your insights and for your presentation. We will move on to our 3rd presenter for this session. So please join me in welcoming Amrita Mahtani. Amrita is the Water and Sanitation Specialist at RTI International. We'll go ahead and share her presentation.
Hello, my name is Amrita Mahtani, and my colleague Umar Berry and I would like to present our work on empowering local change agents in Nigeria. Nigeria is facing a significant crisis where not enough people have access to basic water and sanitation services. Nigerian urban water corporations in Abia, Niger, and Taraba states were mismanaged and not supplying continuous water, nor adhering to drinking water standards. Customers, frustrated by the lack of services, reported losing trust in corporations. To improve coverage, RTI International, through the USAID Effective Water, Sanitation, and Hygiene (EWASH) program, supported sector-wide legislative reform, introduced customer-centric approaches, and rehabilitated infrastructure. However, with many simultaneous changes, the program needed to engage citizens and ensure their voices were heard. RTI, with trusted local civil society organizations, CSOs, piloted women and youth groups to engage directly with often marginalized members of communities. The purpose was to both inform participants and build momentum for citizen engagement for WASH reform. The CSOs established volunteer youth and women's groups in their respective states and met with them monthly to notify them of new WASH updates, help them prioritize WASH issues in their communities, and advocate within their communities. The Amrita Water Corporation had halted water production 7 years ago, resulting in customer distrust of practical reform changes. CSOs met with women's groups to highlight the corporation's commitments, introduce community scorecards, and raise awareness for WASH behavior change campaigns. These groups, made of trusted and influential members, then cascaded these updates via house-to-house visits to over 1,000 households to increase awareness. COVID-19 resulted in both a greater demand for water services, but was met with myths about the virus's transmission. CSOs worked with youth groups in Niger State to go door to door to elderly neighbors to explain social distancing, demonstrate proper mask use and hand washing, and also to answer questions. Participants reported the importance of engaging with older citizens to ease their concerns and stress preventative measures. Sanitation was high on the priority list for the community groups in Taraba. The women and youth groups joined forces with central messaging and advocated to local government and market leaders to reactivate the monthly sanitation exercises, provide public toilets in high-density areas, and improve environmental hygiene in marketplaces. Not only did the ministry recruit a sanitary officer, but it also established a sanitation working group to enforce general cleaning and reactivated market toilets in the city center. Additionally, they invited representatives to join the sanitation coalition to develop statewide sanitation strategies. The eWASH program found that implementing comprehensive sector reform and encouraging buy-in is crucial. The program worked in parallel at the larger statewide policy level to change legislation, at the WASH provider level to professionalize service delivery, and at the larger community structure level with women and youth groups to foster connections with neighbors and individuals. The CSOs worked with these groups in unique ways in the 3 states. With support from CSOs, these groups were able to reach a larger audience and are currently mobilizing more people to advocate to water corporations and join citizen advocacy initiatives. Thank you.
Thank you for your presentation, Amrita. I would invite you to share your poster and maybe give any additional thoughts that you may have.
Yes, thank you very much. And I'm also joined by my colleague, Umar Berry, who I will actually turn the floor over to him.
Thank you very much, Amrita. Good to have you all. Yeah, and one of the things that I would like to add as a lesson that we learned from these engagements by the community groups, we discovered that there was a certain degree of power play amongst group leaders and champions within the smaller groups, and that cascades up to the higher level platforms like the WASH customer forums. And one of the things that we realized that perhaps a more democratic process of selecting who represents what could have helped in not necessarily eliminating those kind of power plays, but perhaps providing a framework for resolutions when such conflicts take place. But generally, and we feel that there's more that the government can do in pushing these reforms forward. And we are thankful to the fact that some of these reforms are already manifesting sustainability, whereas we have discovered some of the government institutions have started replicating some of these efforts in other communities. Thank you very much.
Thank you, Umar, for those additional insights. We invite folks to type out any questions they may have or even comments for both speakers. Please type those out on the chat function on Pathable. In the meantime, I have a question for you. What will be key takeaway points that you'll want this audience to go home with?
Well, one of the key takeaways I would want the audience to take away is for reforms of this nature, it's always essential to use existing platforms by tweaking them to reflect your program design, your objectives, as against reinventing the wheel, so to say. Because one of the things we learned is that those structures that we strengthened, that we found in place, are already showing promises of sustainability as we close out our engagement with the local communities. So it is essential to use
Maybe I can try to also add to Umar's point as well, working with existing community structures, but also we know that with a lot of these reforms and working with state water corporations or the water utilities, there's also very few women who are staff members at utilities. And so then opening up and trying to work with more community groups such as women's groups is another way to get and open up the dialogue, the conversation, and ensure there's representation from a more diverse group of individuals to support WASH reforms.
Thank you so much for taking that up. And apologies, Umar, you got interrupted for a bit, but for sure your thoughts were finished by Amrita, which is a good thing. We still have time for one more question. So there's one in the chat. Someone is asking, did the program also link the state governments with the CSOs? Did you get that, Amrita?
Yes, and I was going to give that to Umar first. I think you're on mute, Umar. He's in Nigeria, and so connection might be a little difficult. So if Umar is able to join, I will give him the floor. But in the meantime, yes, and Umar, please interrupt whenever you're able to connect back. But yes, so we held several meetings with CSOs and governments and the utilities. Maybe one particular example could be at WASH customer forum meetings or at knowledge cafes. So as these were a lot of new reforms that were being introduced through the program and with our program partners, the EWASH program developed these or instituted these knowledge cafes that every quarter in each of the states. It would be a large group of stakeholders from utilities, government, from CSOs, from media, from just open for communities to be able to discuss these reforms and also just have another platform to get more faces in the same room together. And Umar, anything to add to that?
Yeah. Yes, that is correct, Amrita. I mean, prior to the EWASH program, we had community structures like the water consumer forums that are quite separated from.
I think Umar has dropped out, but we can respond to that question in the chat since we don't have a lot of time, and there's more questions coming in, so please keep the conversation going to the chat. So I will transition to the fourth speaker. Thank you so much, Amrita and Umar. Please keep answering those questions in the chat.
Thank you very much.
Thank you very much.
Thank you, I appreciate it. Lastly, but certainly not least, join me in welcoming our fourth speaker, Diana Gonzalez. Diana is a senior research consultant with the Institute for Sustainable Futures at the University of Technology in Sydney. We'll go ahead and share Diana's presentation.
Hello, everyone. My name is Diana Gonzalez. I work at the Institute for Sustainable Futures at the University of Technology, Sydney in Australia. The title of our poster is Influencing Gender Equality Through WASH, using the WASH gem to reveal gender dynamics in Nepal and Cambodia. WASH gem stands for the Water, Sanitation and Hygiene Gender Equality Measure. The reason we decided to develop a way of measuring gender empowerment through WASH is that despite there being an increasing pressure to measure WASH programs' contributions to gender equality outcomes, there isn't a widely used or rigorously validated instrument for doing this. We developed a WASH gem between 2019 and 2020 in partnership with two CSOs, IDE in Cambodia and SNV in Nepal. The WASH gem is a novel quantitative measure, and it has 5 domains, which we will explore during this presentation. Each domain is made up of themes and items or individual questions, which explore changes in both WASH-related gender dimensions, as well as broader dynamics beyond WASH. The measure is designed to be used at baseline and endline to measure change. The approach for developing the WASH gem is illustrated in this figure. The stages of development were a critical review of academic literature and 3 phases of piloting, as well as engagement with practitioners and specialists throughout the whole process. Today, I will present findings from the validation pilot, and the results were explored using both univariate and bivariate descriptive analysis, as well as effect size, ANOVA, and t-tests. Although the measure is designed to be used at baseline and endline, to date, the measure has only been implemented at one point in time, and these are the findings I will share with you. Here are the 5 domains of the WASH gem, and they are not to be added up like in an index, and they are not to be compared. Instead, the measure is to be seen as 5 overlapping and interconnected aspects of gender equality, and each domain looked at separately. We will start with resources. It includes things people have access to, own, or use. And here you can see the average domain score by country and gender. We found that women in Cambodia have the highest perceived levels of access and use of resources, both in WASH and beyond WASH. For each of the domains, we've also included some specific examples of findings of different layers of the measure, which in the interest of time, I won't go through, but you can read in the poster. Now, agency looks at how the ability to define goals and act on them. It looks at things like decision-making and self-confidence. And we found higher levels of agency in Nepal than in Cambodia, but they were similar between men and women from the same country. Now, for critical consciousness, it looks at awareness of gender inequalities that exist within society, looks at perceptions, attitudes, and beliefs. Critical consciousness was highest among men in Cambodia, and the same between men and women in Nepal. Now, structures looks at the formal and informal rules of society. Men in Cambodia and men in Nepal had similar perceived social structures in their communities. And interestingly, women in Cambodia perceived social structures to be more equal than Cambodian men, and the opposite was true in Nepal. Lastly, well-being looks at the health, safety, and comfort of individuals. And we found that the level of well-being in Cambodia was the same for men and women, and it was lowest for women in Nepal. Multidimensional indexes for gender equality exist in other sectors, such as agriculture, and we have developed an equivalent for WASH with a specific focus on the interconnections between gender equality outcomes and WASH outcomes. Gender structures also often focus only on women and their empowerment, but with its focus on both women and men, the WASH gem highlights that men may benefit from empowerment, particularly in more difficult socioeconomic circumstances. Multiple layers of the measure allow us to examine results at domain, theme, and item level, and to unpack which items or which themes are driving the domain level results. And to conclude, this poster introduces a rigorously validated measure and underlying theoretical framework to investigate gender outcomes in WASH programs. The unique context of Cambodia and Nepal provided valuable case studies through which to validate the measure. The WASH gem is being adopted by partners in other countries towards wider global uptake, which is a very exciting development for us. I'll conclude my presentation there. Thank you so much for your attention, and I look forward to your questions.
Thank you so much, Diana, for your presentation. I invite you to present your poster and give any final thoughts you may have.
The old mute and unmute. Thank you very much. Yeah, so I'm sorry, I realized that you weren't really able to read much of the poster text during my pre-recorded presentation. So I hope you can, if there are any details that you wanted to look at, I hope you're able to do so now on the screen. But yeah, I wanted to mention two things that I didn't get to mention in my presentation. So the result that I've shown you are only at the domain level, and they're only by gender and country, but we actually looked at the data from so many different ways and using all sorts of different parameters to explore how different groups perform in their gender equality. So we looked at things such as dividing the group of people or the respondents by their level of wealth, by their level of education, by their marital status, because that has strong influences in gender dynamics and gender equality within a community. And we found really interesting results, which we believe will help CSOs target approaches to improve gender equality outcomes. So for example, if they see that depending on your level of education or your level of wealth, your critical consciousness is different, or your access to resources is different between those groups, that can help them plan and target approaches to improve those gender equality outcomes for those different groups. And just the second thing I wanted to mention is that this is a quantitative measure, but we really strongly believe that it's very important to complement it with qualitative methods to fully really explore and understand gender empowerment. So I will, for example, our colleagues at ISF, we've developed a qualitative monitoring, evaluation, and learning tools designed for exploring gender equality and social inclusion. And I'll copy a link to a website in case you want to explore further what are some of the qualitative methods that we've developed for CSOs in exploring GESI as well. But yeah, I just wanted to mention those 2 points about the importance of also complementing. So yeah, this is a quantitative measure, but also we recognize that qualitative methods are very important as well to be able to get a full picture and the whole story, as we like to call it.
Thank you so much for that. I please invite you to keep posting all the links you may have for further resources for your work on the chat. And this applies to all the other presenters as well. So if you'd like for folks to dive deeper into your work and you have any resources that may be helpful, I invite you to post those out on the chat. And unfortunately, we have to come to a close for this session. And so I will invite folks again to move over to our networking and sponsors session. And we also have a fun trivia session going on after this. So please tune into those. And please keep the conversations going on in the chat. So if you have any questions, any comments for the speakers, they'll be monitoring the chat function. Please keep typing those up there. And at this point, I will thank all the presenters for for this session. So I would like to say a big thank you to Michelle Farrington. I would also like to thank Lizzy, Amrita, and Diana. Thank you so much for your insights, and I will officially close this session. Thank you all for coming.
Thank you so much.
you.